Welcome back from break. We were just talking about Twitter handles for this, like hashtag keep student health insurance great again, or something like that. All right, I'd like to go ahead and welcome up our next panel, Enhancing Student Wellbeing Through Student Health Insurance. It'll be moderated by Ralph Manchester, Vice Provost and Director of University Health Service, University of Rochester. Welcome.
Sorry. So, good morning, welcome back from the break, and welcome to our panel discussion titled Financing Student Well-Being Through Student Health Insurance. Enhancing Student Well-Being Through Student Health Insurance. I've already been introduced, and I would like to introduce our panel for this discussion. Not in the order in which they're seated. Jake Baggot is Assistant Vice President for Student Health and Wellbeing at the University of Alabama at Birmingham and a past president of the American College Health Association. Maureen Cahill is Director of Student Health Insurance at The Ohio State University. Kline is Manager for Student Health Insurance at Pennsylvania State University, University Park. And Dr. Wendy Shanahan-Richards is Chief Medical Officer at Aetna Student Health. Please join me in welcoming them. Today we're going to discuss how student health insurance plans can promote the health and well-being of students, including the roles of essential benefits and the interactions among the insurer, campus staff, and students in promoting health and well-being. The goal of this session is to have a robust discussion of this topic, so panelists, please do not feel limited in your comments by the question and answer format. The first question will go to Maureen. The last panel established a lot of what student health insurance plans are and why they matter. So to start off, how does student health insurance benefit the student?
Thank you. I do think the last panel really established the importance of student health insurance plans. So how do they benefit students? And I had a very good friend ask me that. Why should students buy these? And I was filling page after page of why, so I got it down to one page with a couple main points. Basically, this is a plan that really is focused on a certain population. It's designed by students and for students. And that is really, really important. It balances the cost of purchase with the cost of use. And I know at Ohio State we're really passionate about health insurance literacy. So those are two key concepts. You know, the cost of purchase is the premium and the cost of use is how much is it going to cost you. So the student health insurance plans or benefit plans, they take a different look at that. If you're an employer plan, you think, oh, we can maybe tweak the out-of-pocket a little bit. But when you have students who don't have incomes coming in, you know, creating a higher out-of-pocket or, you know, higher deductibles, that could create a barrier to care, and we don't want to do that. They're good for students who age off of their, you know, parents' plan. Age 26, we have a lot of enrollment there. They're mobile. They are a great option. They follow the student throughout their academic career, so they're on campus or they're on home. And as we know, there's a lot of internship activity now, so it follows them to an internship or study abroad, so that it follows the student where they go. Ease of use, there's a lot of coordination with campus providers, and that's really important. These students own this policy for the first time, so they're navigating for the first time after, you know, age 18. So we have ease of use. The other thing that is important for some students is that they do own this plan, and they may need that kind of confidentiality. They might need to be off of their parents' plan for a lot of reasons. And the other, what I find is exciting is that they get a chance to own this product and manage it, and this is the first time. So we have an opportunity in this time of their life to teach them a lifelong skill. You're learning a skill that you take with you, and if employers want well-informed employees, so students who have this plan they have this opportunity. So it balances in a lot of ways for the student, not only medically, mental health, but also a lifelong skill in learning. I could go on and on, but I'll stop there. I just wanted to just tag on to Maureen's comments, which, were very, very nicely laid out. So you really coalesced a lot into your main points. Thank you. A couple of years ago, I was asked by one of our local universities in Chicago to design and present a course on using your health insurance benefits for their undergraduates. And I wanted to echo what Maureen said about this being a really great learning experience for them, not because of my course, but because many of them said to me, we had this plan, we had to have this plan, and we didn't pay any attention to it at all. And one of the gentlemen in the room said, until I had to use it, then I had to figure out what I had to do. And I asked my parents for help, and they said, this is all yours, it's your policy. And they said, a couple of them were in their third and fourth years getting ready to go out into the workforce. And they said, I'm going to be able to take the knowledge that I got from using my plan and working with the university to understand my benefits. I'm going to know what to look for now when I'm trying to decide if I have a couple of offers, which one I want to take, if the insurance plan for that employer is going to make a difference for me. So.
Good. The second question is for Karen. What role does student health insurance play in student well-being?
I feel like the first panel answered a lot of that, but we're going to kind of hit it from a Penn State perspective. Penn State, they do the Faculty Senate has reported, and I do not have the official numbers. I was hoping to get them before I got up here this morning, but I did not. But if I recall right correctly, the number of students that actually do the paperwork to formally withdraw from the university, about 80% of those are related to medical. That's huge, especially as you look at the student population and why are they actually, is it something that could have been prevented? So Penn State is moving to a university insurance requirement for fall 2019. It's been about 5 years in the making because we have currently a voluntary plan. It is required for our international students and their dependents and has been required for about 30 years. So the international students had been looking for other policies as well, and we had found ourselves in a place of adverse selection. So we were coming to a point, we were losing our international students, and our students, our domestic students, were looking for cheaper alternatives as well. So we have moved because of the health and safety and wellness aspect for our students. We are moving to that. We are very concerned about the underinsured and uninsured students, and they're not covered, so they wait to get their health care. They don't get what they need when they need it, and by the time they do, it's typically at a point, as was said earlier, they need to leave. And so this insurance, having it for them, putting it out there before them, making it a requirement, we're not calling it mandatory. It's a university-wide insurance requirement, but it is basically going to that required for all domestic as well as our international already. So that is how we are going to try to protect our students and be able to keep them in school.
I would just add to that, it's interesting that two of the panelists up here are at institutions that are rolling out expanded or mandatory requirements. So at the University of Alabama at Birmingham, we actually this fall expanded we called it expanded coverage. We expanded our mandatory requirement where formerly it was just international students and some of our students in clinical programs. They're enrolled in the plan, but we had large numbers of undergraduate students in particular that simply just didn't have coverage or were undercovered. And that directly impacted their access to care, in particular the preventive care that they needed, their willingness to do that. And we saw that in the data. The data told us that those who had health insurance of their own or the university's plan would come twice as often and seek care more frequently and earlier than they would if they didn't have that. And so those folks that didn't found themselves in more desperate situations when they sought care, and those consequences were not insignificant. And then the first panel mentioned as well the funding models that many of our programs rely on are relying less and less on fees and prepaid access, although that's still a very important component. But we're also figuring out, okay, how can we support all those other services that complement and contribute to our student success? And so if there's a revenue stream that can be generated to help support that through your insurance plan that makes sense, I think that's something that we're all trying to leverage and take advantage of where we can.
Yeah, I would just add that yesterday we heard about 5 components of well-being: financial, physical, community, purpose, and social. And I would argue that a student health insurance plan contributes to all 5 of those. Financial and physical are, I think, pretty obvious, but insurance, by definition, is a community undertaking, and if we are all in this together and we care about the well-being of each other, then we should have mechanisms in place so that everyone has access to it. And I think we can make the same arguments around the purpose and social aspects as well. The next question is back to Karen. What of the uninsured or underinsured student? How can the clinic staff and the insurers work together to make sure this group of students doesn't fall through the cracks?
I kind of wish Teresa Gallagher were here or Coster, because we've been using she and Diane Plumley as we've been going forward on this. And one of the things that has delayed us moving to a university-wide insurance requirement is the needs of our neediest students and your underinsured and uninsured students. So what we are moving to, and again, I'm going to address this from a Penn State perspective, is we're going to be moving to, there's going to be nightly files between the carrier and Penn State showing what students have done waivers and what students have gone on and enrolled, not paid, because it'll be part of their bursar account with their tuition. So we'll know, but it'll give that student access to their ID card sooner if they go on and enroll. We're looking at the self-funding option. Currently in Pennsylvania, self-funding is not an option. We're trying to not have to do legislation, so we are working with the Pennsylvania Department of Insurance. We've had multiple meetings, and again, this has been a 3 or 4 year process from where we are. We are getting closer. They've given us guidelines. Our risk managers, our governmental affairs, our legal folks are all looking at it and getting ready to respond to what they do not like about it and what they do like. So we are moving forward. We are still hoping to get that in place, but because of the process, we're figuring that will not be by fall 19, but we are working to do that to try to, again, reduce the cost of our plan for our students. The other thing we're working on is the premium assistance for our student health insurance plan. We already work with the Department of Health and Pennsylvania Department of Human Services for the graduate assistants who are subsidized through the university, and they already approve our student health insurance plan and pay the students a monthly fee to cover the costs that the student is paying to cover themselves and a family member. So we are hoping, and according to DHS, they're kind of hoping that we're going to be able to play off of that and move forward. But again, they said we had to have an insurance requirement in place before they can really finish the conversation. So again, we're trying to work with them and moving forward, and now that we know that there's a requirement going to be in place, that'll help with our conversations with them. The other thing we've had to talk through is financial aid. Were we going to make it part of the cost of attendance, or were they going to need to ask for it? And it's kind of been put forth that they're going to ask for it. It's not going to be an automatic piece of that. And we found out we can't do like an annual in the fall and be done. It has to be fall, and financial aid can cover fall. We can do spring and summer in the spring, but financial aid is only going to cover the spring portion. So we've had many conversations. I have found out this process involves so many people in the university that I had never met before. And then we came down to what additional staffing, how are we going to help the students who don't know how to navigate the process? So we've put forth a budget to the executives at the university. We're waiting for final approval of that. But one of the things we're looking at is getting a caseworker that'll work with students who need, so that'll be in my office, and it would be somebody who would work with the students to help them navigate, are they eligible for Medicaid? And if they're not eligible, I've had conversations with students who make too much to be eligible for Medicaid, but they're not eligible for subsidies, and they're saying, I'm not going to be able to attend if I have to do this because I can't get insurance because of where I'm at financially. So we're hoping that that caseworker will be given the training to be able to assist the students that are in that situation. And we've also built in with our insurance carrier that they are giving us a portion of the premium back to help fund that position or another position in the office, so that we'll have the staffing available. Because with Penn State and all of our satellite campuses, our Commonwealth campuses, we're looking at over 100,000 students that we're going to be dealing with in this process. So, and the other thing that we've done is the insurance carrier offers a telehealth and a BetterHelp, which is a mental health telehealth. So we're trying to find ways that are creatively making access to care better for the students, because I don't know about you all, but I know at Penn State one of the biggest complaints is there's not enough mental health providers in the area, and not enough mental health providers to work with our students. And I've heard from other folks that that's the same kind of thing that they're hearing. And so this is just another avenue. It's not meant to replace that one-on-one relationship, but if they're needing to talk to somebody, they can pick up the phone and have that phone call. So those are just some of the ways that at Penn State we have trying to address this, trying to help our uninsured and underinsured students and protect them.
Good. Moving back to the insured student population and going to Wendy and Jake, how can the campus clinic and the insurer work together to promote the health of the insured students?
Okay. I think, first of all, we come together to discuss the resources that, we have as Aetna Student Health and that, our partner school has on their campus. Talk about, how do we bring the best of both together, for the good of the student. For instance, we have various population health programs. We also have one-on-one case management. And we always emphasize, we as the payer, we do not provide medical care or behavioral health care. We're there to help facilitate and work with the schools so that, again, the students can have, the best access they can. So I think the first step is really to discuss the resources we have and what is the best way to use those resources.
I think, plan design is really an important element of that, and all of our health centers vary considerably in the things that we can offer both on campus, and much of that we offer on campus is driven by what's available in the community and our students' ability to access those services in a timely manner. If I were to provide access to our student health services in the same manner that a member of the community can get access to primary care, that wouldn't be satisfactory for our students' needs. And I think most of you can relate to that. They need access to care when they're ready and in a timely manner, and we don't want to create another barrier for them to do that. So plan design to capitalize on what's available on your campus, to also improve compliance with care plans is also very important. And so working closely with your insurer or if you're self-insured, working with that plan design to make sure that you capitalize on that. The network access is also important. More and more of our students are looking for experiences outside of the campus, and often that's away from your community, or the online students is also another area of need. So making sure that your network has a broader reach than what's necessarily available right there in your community is also important as we expand those kinds of things. Those are a couple of examples.
Sure. And I had one other too. I think we each come to the table with different types of data assets, if you will. So we have claims regardless of where the care is rendered. It might be on campus, it may be outside of campus, and to be able to take a look at the demographics of the population and understand any kind of diagnosis drivers, not just in terms of cost, but utilization, and where may the programs that, we have available or that, school has available be best brought to bear to help give those resources to the students. And so, you have the clinical data, you have your records, and, on an individual basis as well as, again, on a population basis from the clinical standpoint, what's going on. And, we have the claims data. So, we've tried to work to come together to say, how can we make the best use of that? Again, in the spirit of well-being, what are we looking at here?
I think I would also echo that in working together. If your plan is working together with an insured, designing plan design for ease of use is critical. So having the insurer be a partner to create tiers or to create the highest level of benefit for your campus providers. I think that's really critical because, again, students are learning to navigate on their own, how to take care of their own health care. So I think I would echo what has been said. I think that's really important.
For Maureen and Wendy, how does the insurer work with other departments on campus to further the health and well-being of the insured student population? And when we use the word insurer, how do our various constituencies understand that word?
Sure. Yeah, great question. I think that, we take the lead from the school as far as, who would you like us to communicate with? Who would you like us to work with? And, the response varies by the school, by the size of the school and the organizational structure and the functional structure. So, in some instances, we're working, our account managers are working, directly with someone in the insurance office, maybe people in the health center. I work with individuals in the health center, and sometimes, I'm asked to work with our account team, meeting with committees. It really depends on the nature of the school, and so we definitely take our lead from you all.
I would definitely agree with that. And the definition of insurer that I'm going to reference is our medical policy partner, the entity that takes the risk. And in our instance, we have a dedicated office to administer the health benefits plan, and we appreciate that the insurer listens to us and really works with us to create the best student experience with this plan. So in working with other departments, again, I think I mentioned the tiering or the steerage to the campus care. That's where you work with other departments. We ask for data. Data is really important. We have a committee, and we present to the committee, so we ask our policy partners to come talk to our committee, which is faculty, staff, and students, about the plan. So we depend on them to give good information, good guidance, and recommendations, so the committee can hear what they're seeing or what's happening in their book of business or the industry, help us get out in front of something they may see before us. So we appreciate that it's a partnership, and it's a critical partnership. And having a medical policy partner that knows each university wants to communicate to their students in a way that works for them, and having a policy partner that understands that also helps make it a successful relationship.
Also, as we navigate this and administer and work with our plans, we have to be very conscious of our responsibility, our fiduciary responsibility in particular. And those conversations become important when a dean or the president or the provost contacts you about a particular student's situation that isn't working well in terms of their access to health insurance coverage. And so, being out in front of that and making sure they understand our role and our responsibility, it protects the overall health of the plan. It's easy to say, well, the insurer didn't cover that. Well, the insurer is doing what you've designed. And if you work well together, everybody's on the same page and can navigate those trickier situations. But we have to, that's something we have to be very conscious of.
Jake, what trends are we seeing in student health insurance as the college health field changes to emphasize holistic well-being?
So, access to care is something that is a primary need here, and as more and more of our centers are looking at integrated or multidisciplinary strategies to address that, our insurers are recognizing the value of that, and it's important for us to communicate effectively about those programs, or to be innovative in terms of figuring out how to structure those resources within our programs to provide that. And as we rely on revenue streams outside of our fees to help support some of those things that aren't reimbursable or that are still important to our student success, we have to think through those things as well. The Mental Health Parity Act is obviously a legislative result that has helped access to important things like mental health care, and then just administrative efficiency really is also important, that we take advantage of the ability to process data and financial transactions with our carriers so that we can optimize the resources we have available for our students as well.
I think one of the other things too, and Jake and I talked a little bit about this earlier today, is when we look at, holistic well-being and some of the healthcare services that, if you look back, 10, 20 years ago, you never would have seen covered in a plan. So things like acupuncture, or, more recently, services for gender confirmation surgery. And so we, take this very seriously between our account management team and myself working with the schools and myself working with some of the clinicians at our schools to get feedback to say, for this population, which, we do not cookie cutter across from commercial over to student health because they're very different populations, as you all know better than me. What is it that you feel is kind of a gap right now? And, we have, just like, other carriers, we have, Clinical Coverage Policy Council, which I'm representative for Aetna Student Health, but we have practicing physicians and pharmacists and other clinicians that provide their input. And they're looking at the evidence-based research to see, in terms of, what is proven care, where is the safety pieces, in terms of adding coverage, various services to the coverage policy. And so we take all that input in, and I think, part of looking at whole, well-being, particularly with mental health, covering under a clinical policy coverage as well as the administrative coverage benefits, it's just so important to take that in if we're going to really look at well-being as a whole.
This is a great space to be innovative. This whole summit is about innovation, and so our insurers are often, invested partners in trying to come up with innovative strategies. So we have this space that we can think of different ways to approach problems and maybe try things that we might not have been willing to do or able to do in a more conventional setting. So I think it's a unique opportunity for us, and many of us have been able to do those kinds of things.
I would echo, when you think of holistic health, it also, we have to be conscious about how to deliver some of the care. So the telehealth and the better help options, and I'm just using the two programs that I'm familiar with, but, the virtual counseling, those programs are meeting the students, at least the incoming students, where they are now. There seems to be a comfort level doing online. So I think holistically, we think about, from head to toe and how do we deliver that. And part of, again, holistic health is being financially healthy as well. So at Ohio State, we have 9 dimensions of wellness, and financial health is part of it. So that also is how Student Health Insurance Benefit Plan supports holistic health as well.
This last question is for the panel at large. What are essential benefits, and how does that coverage intersect with student well-being? If essential benefits coverage is lost, or many students begin to lack that coverage, what ways can student health insurance plans be utilized to promote student well-being?
Essential benefits are basically saying you've got to have dental, you've got to have preventative, you've got to have maternity, you've got to have the birth control at zero cost. They're going into all the, I believe it's 10 details of what the plan absolutely has to cover. That being said, if those requirements made a lot of our plans who were short-term limited duration plans have to step it up. I don't see any of us going back because I don't see any of our universities wanting to be that university that has to say, oh yeah, we went back instead of stayed with where we were at. How do you explain that to your student groups? So how does it, the university, I think at that point, really has a responsibility to step it up and protect their students. I would hate to see people go back to the voluntary plans to the short-term limited duration, where I think we would lose our students and hurt the very people that we're supposed to be helping.
I think this is an opportunity for institutions to self-govern or self-look at what they want to deliver. There were many institutions that actually created health benefits plans that covered a lot of the essential health benefits before they were mandated. So this is an opportunity to maintain best practices, and I think that, partnering with your medical policy partners, there's enough claim information that you can really balance out where the stress points are in pricing your plan. And I don't know off the top of my head, but you can have intelligent conversations about really if we don't cover this, is it really going to save that much? So I think the benefit is having that for a while. We have good data to analyze the impact. And again, I think it's just an opportunity for the institutions to be leaders in this. I know some were leaders before that, and it's worked out well. So I think it would be up to each college or university. And we would hope that they would maintain the standards because it's working.
Yes.
And that's one of the things that gives me some of the most positive feelings about the work that I do, that I do have the opportunity to have a significant voice in the design of the healthcare that 10,000 students at the University of Rochester get. With that comes a substantial responsibility to make sure that that care is delivered and designed well. But yeah, that's exactly where I think all of us are at and want to be at. So I understand we have some questions from the audience.
We do. First question was, do you think universities are now allowed to offer short-term limited duration plans as an alternative to ACA compliant plans?
I would hate to be your legal counsel and answer that for you. Even if it is allowable, be very careful. I know that our Pennsylvania state system of higher education, PASHE, has had a voluntary plan. They have since stopped offering that plan. They're sending their domestic students out to healthcare.gov, and the international students that they are bringing in to the short-term limited duration, here's some plans that are available and meet the requirements of your visas. That, as a school, I think you really want to make sure your leadership are aware and say, really, do you want to be that school? Do you want to be the ones that say, we're going to give you a lesser plan? And when I started in this field, I started on the insurance side of the house. I was working with the insurance for over 10 years before I came into Penn State. And I remember trying to wrap my head from being on the employer side to this student world. And as I was at, I think it was one of the ACHA meetings, I heard somebody say, would you put your own child on the plan that your school is offering? Would you remove them from your insurance plan and put them on the plan you're offering? And I am ashamed to say at the plan we had at that time, I was like, heavens no. Now I could honestly say if my kids were in college, yeah, I would. And I think that's where you need to think, yeah, it may be cheaper to do a short-term limited duration, but are you really looking out for the welfare of your students when you're doing that?
I would think too that, we've been talking about well-being and the various, foundational pillars, and, if essential benefits go away, and particularly the preventive parts, we're trying to instill in these young people who, many who, are very healthy and some who aren't, but that, as they kind of move into later adulthood, that they want to be maintaining good health habits, and they want to make sure that they're getting their preventive screenings. And so if we go to plans that don't include coverage for the preventive benefits, my concern would be, at least from a clinical standpoint, that we're going to see maybe some good habits that started to develop during the time they were on a plan with essential benefits start to go by the wayside.
Yeah, I would just add, it's our opportunity and our responsibility to really help people navigate and understand how these plans work and set those practices going forward. As we rolled out our requirement at UAB this year, I prepared the administration that we would get some pushback from individuals that maybe didn't think this is something that we should be involved in. I was pleasantly surprised at how little pushback we got, and as a matter of fact, I was even more surprised, and again pleasantly, that a number of families recognized the value of that because of their own struggles with trying to provide coverage to their students, and more than one certainly were interested in what they could do to be a part of the plan as well. That's obviously wasn't in our actuarial best interest. But people are starting to recognize that. We've been through enough experience with ACA that people are starting to have a better understanding what health insurance plans, good ones, look like. And they also, when they lose that, or that they lose those benefits, or they're deteriorated in some way, they also understand the implications of that as well. So.
I would also caution, word of caution, think about the implications. From what the understanding is, those can have exclusions, and those can exclude access to certain care. So if you have a population of students who are excluded from access to care, particularly mental health, look at your campus resources, and you can feel how strained they are now with students with insurance now. Extrapolate that and imagine what could happen. So I would advise maybe hitting the pause button and really looking at the implications of what that would mean.
I think clearly we all agree that this is something that if you're seriously considering, you should get expert advice from people with the appropriate legal and insurance backgrounds. For every complex problem, there's a simple answer and it's wrong. And I think in this case, the simple answer is, well, if you have short-term limited students, then maybe you ought to get them short-term limited plans.
Okay, the next question that we had was, how does self-funding your plan benefit your student population health and well-being aside from controlling cost?
I think one of the things that Ralph had even mentioned earlier is if you're self-funded, you have a little more ability to make the plan what you want it to be. You still need to protect the plan and make sure you're not going to run it into the ground in 2 or 3 years, but you have the ability to set a little more of what is the expectation for a deductible, what copays do you want, rather than have to meet a platinum, a silver, a gold, or whatever level. You can say, look, this is where we want to be, this is what the university is willing to put on the line, and then you can do those things. It's not saying you're not going to be ACA compliant, because you still have to file your information with CMS, you still have to make sure that you're approved, but it just gives you a little more flexibility, as well as hopefully reducing the overhead cost. You still have to have a third-party administrator, which I know if we get self-funding approval and the university decides to go this way, we've got to do another RFP, because we're going to have to go out to bid for a third-party administrator. It's not just a simple, I think I want to be self-funded. But yes, it helps to reduce the cost, but it also, hopefully you can lower some of the costs for your students in the care that they're seeking.
Yeah, our plan at the University of Rochester is now early in its second year of self-funding, and we were able to reduce the premium by 7% and eliminate about $350 worth of deductibles for year one with very little change for year two. But we do have to be careful, and it was basically one full-time equivalent working for 2 years to get it set up in the state with the most complex regulatory environment in the country, as I understand it. I've never experienced any other, but I hope I never experience a more regulatory environment.
All right. The other question we have is around Medicaid students, is how do you handle students that are covered by Medicaid, but they don't have access to the preventative services such as vaccinations?
So at our institution, our providers, we work through the medical system, and so all our providers go through a credentialing process. When students present with information about having Medicaid, we advise them to try to identify us if that's permissible, if they're within our state in particular, to identify us as their primary care provider, and then we can start addressing some of those kinds of issues that way. Some choose not to do that, and sometimes we don't learn it until it's at the point of care, and that becomes more challenging.
I have a clarifying question. Can you identify it as in-state Medicaid or out-of-state Medicaid or just Medicaid in general?
The question doesn't specify, so maybe look at it from either direction.
From what I've heard from our Student Health Center, that's where that identification might happen first. They present. So what we would do is, if we have the opportunity and they contact us, we would try to find a way where they could enroll in our student health benefits plan. We work really hard to try to find resources to help pay for it. Otherwise, the student is sent to community resources if those are available. We try to manage the student as best we can within the limits of the Medicaid that has been presented by their Medicaid, but we definitely don't leave them hanging out there.
Yeah, and we talked in the previous panel about the SHIP in lieu of Medicaid possibility. I believe it's Montana, Minnesota, and Massachusetts. So maybe we just need to call ourselves Mu York, and then we'll qualify. So because we begin with them. But each state has to consider this on its own, and as I mentioned, New York State, it looks like they're going to consider it on a school-by-school basis until we get maybe to some critical mass. And Mike Huey mentioned in the previous panel the dilemma that we face with students coming to our campuses with an out-of-area Medicaid plan that we know is not going to cover the same kinds of services that students have coverage for on our own plan or most of the commercial outside plans. And what's the right answer there? On the one hand, and the decision we have made is we cannot tell someone who's got limited financial resources and does have a health insurance plan that is set up for people with limited financial resources that, sorry, we don't take that, we're the ivory tower here, and you need to pay all this extra money. But then we encounter the problems of getting them access to care on a regular basis. Some of our medical students are on Medicaid, and they think it's a great bargain when they sign up for it, and then they come in and they need to see a subspecialist, and there are no subspecialists they can see. They go to the resident clinic for that particular subspecialty, and that could easily be the resident they're going to be on a team with on their rotation next month. And it's not a good situation, but we don't have a better option for them right now.
All right, we have one more question. Do you ever find that families are too quick to dismiss student health insurance plans and keep students on their plan instead? What more can be done to make the benefits of SHIPs known?
Okay, so you get your students on Snapchat, let them take a message you've sent out legitimately, put some incorrect, semi-correct question on it, and create enough calls that the entire university gets flooded with calls and your office is getting inundated going, why are all these students calling us? That's what happened to us this fall. After all of the marketing and everything we've done to try to let students know that we're preparing for next year, and the process we're doing for them this year is just to gather the information and to get them ready for next year. That's literally what one of our students did. At first we were kind of frustrated, and then we went, you know what, best marketing tool ever. Can I tell you, we got more parents contacting us, as well as every other department in the university, but they contacted us asking questions, and we were able to provide that information to them. So while I really would not recommend that, it was a great tool for us to be able to put information out there. We're also educating all of our partners As I said earlier, I've learned that there's more areas within the university that I've never communicated with that I do now. We're educating them and making sure we have an internal database that's available for them to help answer questions. So we're working with the parent groups, we're working with our new student orientation, and our biggest concern is not so much the parents or the new students anymore, but how do we get the continuing students to listen and pay attention?
I would echo some of what Karen says. We actively participate in new student orientation. We developed an online comparison tool. So we have some specific marketing targeted at parents and families who are making decisions. So we developed a tool for them to do a quick compare, my plan. And to the answer to the question, yes, because we'll get the call in the middle of the semester saying, you know, we should have made that decision. So we provided an opportunity for a student who did not choose it to choose it at the next semester open enrollment period. And we also work with our parent and family newsletter in student life. We have a department, so we actively focus on how to get in front of parents and families who are helping their students with this decision.
We did very similar strategies. As a matter of fact, with our parent and family associations, we actually conducted a webinar for them to call in and ask questions, and that was a very effective way for us to talk about these things in a conversational way that I think people appreciated.
Great. I'd like to thank all of our panelists as well as our live and live streaming audience members for joining us this morning. I hope this panel has provided some insight and might spark some discussions in the coming weeks on some of these issues. We will be taking a 10-minute break and reconvening at 11 a.m. for our next panel, which is ensuring the well-being of international students. Thanks.